Thanks everyone for joining in. We'll give a couple of seconds to make sure that everyone can enter into the room. Okay, good morning or good afternoon, depending on where you are in this globe. Thank you so much for joining us today. We're delighted that you all have joined us in this discussion on cultural adaptations and dementia caregiving. My name is Lauren Parker, and I am a member of the Leadership Core and co-lead of the Health Equity Task Force of the Bold Center of Excellence on Dementia Caregiving. Today's talk will focus on cultural adaptations for African American and Latino populations. This talk is of extreme importance as these communities are nearly twice as likely to have dementia compared to white populations. Given that these communities often rely on informal caregivers like family and friends to provide care, there is a huge demand on public health agencies to critically adapt their service programs and interventions to make sure that they fit the needs of African American and Latino populations. Our goal for the talk today is to inform and to inspire you on ways to culturally tailor services to support the needs of Black and Latino caregivers. Our talk today is, of course, on Zoom, and we'll have a live recording and it'll be shared on our website. But in addition to the Zoom space, we're also taking the conversation to the virtual world. So please follow the conversation, ask questions, interact with the different speakers once we finish this dialogue, and use the hashtag Culture Matters in Dementia. Jason Resendez and Ocean Lee of Diverse Elders Coalition will be using the hashtag and Twitter to have a conversation. Also, please follow the Bold Center using the handle PICO_DC. The symposium today is being presented by the Bold Public Health Center of Excellence on Dementia Caregiving in collaboration with UsAgainst Alzheimer's Center for Brain Health Equity. So now I just want to share a little bit about the Public Health Center of Excellence on Dementia Caregiving. It is designed to support state, tribal, and local public health agencies nationwide in developing the dementia caregiving focused programs and initiatives. There's three focuses of the center. One is improving access to evidence-based programs and practices. The second is really to facilitate connections and collaborations for public health agencies to interact with a wide variety of organizations. And the third feature, which I think is really critical, is to provide technical assistance to public health agencies for help with identifying, selecting, and implementing effective public health interventions. The cultural adaptation series that we have today is just one of many services and opportunities that we have. We really encourage public health organizations who are on the call today to reach out to us if there's anything that we can do to help you all identify or put together public health programs to really support dementia caregiving. And while we encourage all types of dementia caregiving, we're really focused on informal caregivers, so caregiving that is focused on family and friends, and also for service providers. So now I'm just so happy that I have the opportunity to present this wonderful group of scholars and practitioners today. The first speaker that you'll hear from is Jason Resendez. He is a great colleague. In addition to that, he is executive director of the UsAgainst Alzheimer's Center for Brain Health Equity and chief of staff of UsAgainst Alzheimer's. He is also the co-lead of the Health Equity Task Force of the Bold Center. From clinical trial inclusion to paid family leave for family caregivers, he champions brain health equity at every level of the healthcare system. In 2020, Resendez was recognized as one of America's top 2020 influencers of aging by PBS Next Avenue. He has contributed to peer-reviewed research on the socioeconomic impacts of brain health inequities and on the science of community engagement in neuroscience research. Jason has been quoted by the Washington Post, the Wall Street Journal, Stat News, Time, Newsweek, Univision, and others on health equity issues. Thank you, Jason, so much for being a part of the conversation today. We look forward to you live tweeting and also for presenting on the social and environmental factors that shape the disparities in Alzheimer's disease. Next up after Jason, we'll have Dr. Fayron Epps. She is the principal investigator of the Faith Village Research Lab and assistant professor at Emory University, Neil Hodgson's Woodruff School of Nursing. She is also a member of the Health Equities Task Force on the Bold Center. Dr. Epps has been a nurse for over 20 years and has served in many clinical and leadership roles in the hospital setting. She has devoted her career as a nurse leader to reducing health disparities for underserved populations through innovative, culturally relevant programs for the African American community. She works closely with the interdisciplinary team to promote quality of life for African Americans living with dementia and their family caregivers and care partners through self-care and meaningful activities. Dr. Epps is the founder of ALSER, the only nurse-led dementia-friendly initiative to support African American congregation. Dr. Epps oversees several faith-based research projects and is active member of several local, regional, and national organizations. And last but certainly not least, today we have with us Dr. Judith Rocha. She is a licensed clinical social worker and director of field education for the Masters of Social Work program at Northeastern Illinois University. Her work in the last 25 years has included parenting education and counseling for children and families in the Southwest and Southeast sides of Chicago, where resources are oftentimes few and opportunities for higher quality of life can be challenging to reach. Her research includes Latinx relevant social issues with the focus on family caregiving of Latino elders living with Alzheimer's disease and related disorders. With input from dementia family caregivers, content area expertise, and service providers and other stakeholders, she developed Caring for Caregivers Organically, COCO, a culturally relevant and responsive health education program for Latinas that are caring for a family member with dementia. As a caregiver herself, providing care for her mother that was diagnosed with Alzheimer's disease over 15 years ago, there is a personal passion and a commitment to this work. After knowing most of the speakers here on this call, I can say that the passion thread runs through each and every one of the presenters that we're going to hear today. I'm so grateful to now turn the Zoom floor over to Jason. Jason, thank you.
Great, thank you. Thank you so much, Dr. Parker, for that amazing introduction. Excited to join everybody today for this important conversation about how to turn research into practice to support public health agencies in the delivery and development of culturally tailored dementia caregiving programming. I want to first provide a little bit of background on the work of the UsAgainst Alzheimer's Center for Brain Health Equity and our collaboration with the Bold Center of Excellence in Dementia Caregiving. We're really focused, supported by the Healthy Brain Initiative, and driving collaboration to disseminate culturally tailored brain health strategies for Black and Latino communities. And we do that by focusing on three areas. One, mobilizing and educating minority serving health providers with a particular focus on nurses in partnership with the National Black Nurses Association and the National Association of Hispanic Nurses. Second, empowering communities with data to develop public health programming. And third, making culturally tailored brain health messages and resources available to communities and providing guidance in the development of those resources. And just a quick overview, why is this important? Why is this focus on cultural adaptation important in the work of public health and responding to dementia? Well, as Dr. Parker underscored, there are major disparities that Black and Latino and other communities of color and underserved communities face. And today, as part of our three-part series, we'll focus on disparities in the Black and Latino community, but we'll focus on additional populations in future iterations of this series. So in terms of looking at the Black and Latino community, we know Latinos are 1.5 times more likely to develop Alzheimer's than non-Hispanic whites. Black Americans 2 times more likely to develop Alzheimer's and related dementias. And when we think about why is that those disparities exist, oftentimes we point to comorbid risk factors that are higher in these communities than non-Hispanic white communities, including a higher risk of stroke, of obesity, of heart disease and diabetes. And certainly these are factors, but we're learning more and more about the non-biological factors that shape dementia risk in later life. And so we're recognizing that place matters when it comes to brain health. And I'm sure we've all heard the fact that our zip code is a greater predictor of our health over the lifespan than even our DNA. And so when we think about the role of place in brain health, we have to recognize that it matters greatly. And we're seeing more and more research emerge from places like the University of Wisconsin, for example, showing the relationship between community level disadvantage and risk for dementia in later life. So we're learning that the place-based factors or social determinant factors play a role potentially in shaping dementia risk in later life. And so for us at UsAgainst Alzheimer's, we felt it was important to start to better integrate community level data into our understanding of how Alzheimer's is manifesting at the community level. So we partnered with the National Minority Quality Forum to develop a tool called the National Alzheimer's Disease Index, which allows us to aggregate Medicare data and visualize that data by demographics and by geography. So we're looking at the zip code level all the way up to the state level, but we can even look at congressional level and metropolitan statistical area to just understand where within the Medicare program are disparities manifesting in Alzheimer's. And we took that a step further last year in partnering with the Urban Institute to identify the top 25 counties most impacted by Alzheimer's among Blacks and Latinos in the Medicare program, and then look at those counties to better understand the social determinant trends among those counties that are the most impacted by Alzheimer's compared to those counties that are the least impacted by Alzheimer's. What did we see what perhaps themes would we see when it comes to the social determinants of health when we examined this data, integrating claims data with social determinant data? And what we found was, I think, really striking. First, just looking at the geographic distribution of these highly impacted counties. So this is the top 25 counties impacted by Alzheimer's among Latinos. We see a high concentration in places like South Texas, actually where I'm from. It's always striking to see my home county of Jim Wells being in this list in South Texas, but then also places like Southern Florida impacted by Alzheimer's. And then we look at the geographic distribution of the top 25 counties among Black Americans. We see a different distribution with places like Mississippi and also Texas and Nevada represented as well. And so when we looked at the social determinant factors in these counties, pulling from data sources like the Robert Wood Johnson County Health Rankings, for example, and also looking at NHANES data, what we found is that in counties most impacted by Alzheimer's among Blacks and Latinos compared to those counties least impacted by Alzheimer's, we saw deep inequities in the social determinants of health. And so in those counties most impacted by Alzheimer's, we saw higher percentages of families living in poverty. We saw lower median household incomes. We saw higher levels of uninsurance, and we saw fewer opportunities to exercise as represented by the built environment. And so we see generally worse social determinant trends in these counties that are highly impacted compared to those counties that are the least impacted. And when we look at education, education across the board for our 3 county groupings. So we looked at the counties that are most impacted among Blacks, among Latinos, and among whites. And what we found is across the board, educational opportunity and attainment was generally worse in those counties most impacted across these groupings. And so what does this tell us about Alzheimer's in these communities? One, we're not saying that these factors are the cause of these rates of Alzheimer's in these communities. But what we are saying is that these are the realities on the ground in these communities. These are the social determinant realities that we have to take into consideration as we develop interventions, as we develop communications, as we develop policies to support communities. And so for the first time, we have a social economic profile of these highly impacted counties. The other reason why this is important is because more and more research is pointing to the opportunity for risk reduction when it comes to dementia in later life. And so I'm sure we're all familiar with the Lancet Commission, which found that up to 40% of dementia cases could possibly be presented by addressing certain modifiable risk factors. So by increasing education, by increasing physical activity, and by decreasing things like obesity, smoking, and diabetes and exposure to air pollution. And we can modify risk for dementia potentially over the lifespan. At the same time, when you look at the data that we just presented, a lot of these modifiable factors are also structural inequities in communities, right? You can't write a prescription for better education and expect folks to be able to act on that equally. So what this says is that, and it's an important reminder, that not everyone has the same opportunity for brain health across the lifespan. And we have to take account of those inequities in the development of our programming. And so how are we turning data into action? Well, one is using this data to tailor public health messaging about things like subjective cognitive decline. So this is leveraging BRFIS data, which is rich data on subjective cognitive decline that is available by subgroup, that's also available by state. We partnered with the CDC to take that subjective cognitive decline data and develop population-specific communications. So highlighting the impact on the Latino community, highlighting the impact on the African American community, and also on women, which is not pictured here, and putting that side by side with information about the importance of having conversations with providers about memory health. And so this is one example of taking data, publicly available surveillance data, and packaging it in a way that you can use in communications to specific subpopulations. So one high-level example of adapting available data to inform public health communications. We've also developed a platform called Brain Guide, which empowers people with knowledge and resources around brain health, and based off of a series of questionnaires which have been validated by providers, including providers of color, the development of or recommendations of resources that are tailored. And this is available in English and Spanish. It includes a rich set of resources, including all of the subjective cognitive decline infographics that we've developed as part of the Center for Brain Health Equity. So a few links to join us in collecting and utilizing data, accessing resources, and signing up for resources. We welcome you to join us in this work. And with that, I'm excited to turn it over to Dr. Fayron Epps, who, as Dr. Parker mentioned, is just an amazing change maker who's taking research and making sure that communities are embedded in that research and that research is responsive to those communities. And she's just a big role model to me and so many in the movement. So with that, I'm pleased to turn it over to Dr. Epps.
Thank you. Thank you so much. That was such a great presentation. If you give me a few seconds, I'll be able to pull up my information. All right. Well, welcome everyone. Thank you for taking out time to talk with us. Today, I wanted to speak to you all about ALTER, which is the dementia-friendly faith congregation program that I do with African American churches. And this program officially started in 2019 when we decided to turn it into a full-fledged program. And a lot of people asked me, well, why the church? Why do you start here if you want to work in the African American community? And there's a lot of literature that supports how the church is the cornerstone for many communities, but specifically for the African American community. And I want to actually give you all, as it relates to the geographic location, me residing in the heart of the Bible Belt. So, why not go to the church? Also, I had a community advisory board when I moved to Georgia, and, they advised me on the research, the programs, the interventions that need to be done. And again, it's answering the needs or responding to the needs that are in the community. And they said, you have to start with the church. And I asked them why, and they said, well, the pastors have dementia. The pastors are, preaching, they're teaching, and they're caring for their congregation who have members with dementia, and they look up to the pastors, but the pastors have no knowledge about this. And I really believe working with the church is a great opportunity for us to partner, for healthcare research to partner with them, because it's so many needs can be met if we give them the tools that they need, the knowledge, to be able to support their parishioners in the communities that they serve. This program before it became a program, it started off as education, because when the community advisory board said we needed to do this, I just called up some of my colleagues and asked them if y'all had some time on Saturdays and in the evenings for us to come up with something where we can go into churches and do education. So I just want to give that history to you to let you know how it all started. It wasn't just me coming out with with a team saying we have a program. It started off by us just giving up our time and doing education and meeting the needs of the community through that standpoint. And when we have the opportunity to put into the program, and our whole goal is to inspire and equip faith communities. We want to encourage culture change and shift the perception of dementia, and then also strengthen the supportive services that are within African American churches and available to the African American community. And part of this program, we establish partnerships. So that's what makes it different than just going in and providing education. We hang on to you after the education. And for those that are committed and want to make a difference, we establish these partnerships so we can create this supportive environment for those families that are affected by dementia. This program, I have to say, is supported through HRSA, through the Georgia Geriatric Workforce Enhancement Program. It's one of their programs that they sponsor. So I would like to acknowledge that. So when we go in to meet with the churches, we make sure that we share with them what the problem is. And, a lot of the things from the prior presentation had spoke about this. And one of the main things that, we highlight all of those facts, and we just make sure that the church is aware of what's going on, and highlight how the church is just more than a place of worship. And I spoke to that earlier about how it's being that cornerstone, but also a safe haven, a second home for many. And then when we're speaking to the pastors in the congregation, it's not us just bringing resources. We also want to stress how important the spiritual needs of these families are, and how we also need to come up with ways to continue to meet their needs. And then I stress that the impact of dementia has pushed many members away from the church. And when you share that with the pastor, they don't like to hear that, but it's the truth. And I tell stories how important it is, because you have these faithful members that have been here and they've been tithing, but when they don't feel that they're supported, when they cannot come to the church to get help, then they don't come to the church at all, and they don't financially support the church. And again, our goal is to work to preserve access to churches for those families living with dementia. And so part of this program, we present solutions to them. So we have training sessions for our leaders. We offer support in person, which was the best, but now it's virtual and it's still great. We do offer education sessions, but we also connect them to others that can provide education. And we give them tools, techniques, and just ongoing support to help address some of the cultural taboos that are associated with dementia. So part of our church partnerships, it's not that any church can come and be a partner and say, oh, yes, we want to do this. It's really a process that we go through. And I know a lot of those that are attending would be like, well, how do you establish these church partnerships? And I kind of mentioned some key things before, but I want to stress that it is very important to learn about the history of the church in that community. So when we're trying to bring in programs and interventions that will, promote behavior change or something like that, we need to understand that history. And that takes time for us to really to understand how long this church has been here, what has been the role of the church, what has the church already been doing to support these communities, any other health initiatives that they're part of. These are all things that we need to know. Also, when we're contacting a church, we always have a team, most of us, and you want to select the best person. That's really crucial because pastors are busy, ministry leaders are busy. And so you want to make sure that you have the best person that's going to represent your program, your intervention, and can deliver the message. And as it relates to the message, we want to make sure we have a clear message and a clear ask of what we need, because so many people approach the churches. So we want to let them know exactly, this is what we're here for, this is what we need you to do, and this is what we can do for you. Have honest conversations. So in my previous slides, given those statistics, I'm not just BSing with them. I am just, this is what it is. This is how it has impacted families, bringing my research results and other results from my colleagues that, we're out here doing the work, sharing with them those facts and those statistics, and letting them know this is what we need. And in return, we have to be open, because that honest conversation is going to lead to some open dialogue. And, it might not be important for them, but that's okay. We would just be persistent, gives us the opportunity to come back and share the message. Being persistent is really, really key. And making sure when we introduce something to the church that they can see how it can be sustained. They don't want to see us coming in and introducing something to their community, and they don't see how it's going to be long-term. And we might not have it figured out at that moment, but we need to at least say that we have plans and we're working to make sure things can stay in place. And I think that's very important. So when we do the church partnerships, we have our churches do a MOU. And to me, that is so key. Once they put their signature on this agreement, they're committed. And we go very detailed of what we ask of them. And then we have a partnership checklist. And that is, it helps, because it sounds like it's really broad. And so when we have a checklist, then they can select items. There's required or core activities. There's additional activities that we ask for. It's altogether 16 activities and initiatives that we would like them to implement over a 2-year period. And then we give them opportunities to create and customize activities. And I think this is important for us going into the Black community and other communities. We cannot come with our own agenda. We can have some things that we would like to address, but we also have to, especially knowing that history of that church, what they have in place, work with them to customize some initiatives and activities. And I think that's very important. And I think they really appreciate that. We provide them with a welcome kit, just to, give them a foundation, what they can start. Because as soon as they sign up, they may get a phone call that night or the next day from a family that's affected with dementia and or facing dementia, and they at least have something to go to immediately. And we provide a financial contribution to the church. And, the reason why we implemented this is because you have to know your community. You have to know. And I was getting faced with, we're asking them to do things, but they have to come up their own budget. And so, I understood that. And if by providing this, then they can be a little bit more creative with some of the activities that they're doing. And in return, they're teaching us, hey, you didn't think of this, but this is what we did. So it's really turning out to be great. Part of that checklist, just to go a little bit more, it's divided up into those core activities, but then also the remaining activities falls under 3 categories: education, support, and worship. And these are some of the examples of this. And we provide them with a guidebook. So again, it's not just saying you need to do these things. We've taken time to create a book, and not a pamphlet, a book of all the different things that they can do to meet the initiative or the activity. And we provide pictures, links, additional resources that they can get. And this book is, they have a physical book, and then they also have it available through PDF. So this is a lot, right? But I just kind of wanted, for those that are on the call, to kind of show you how we broke this down, because again, when you're trying to do programming in different communities, we have to be like, okay, what we want to do, what are our activities, what are our outcomes? And this is our piece of our logic model. And I just want to kind of highlight 2 pieces of it. The team meeting, the activities, team meetings and training has been very key for my staff, for the leadership, for my advisory board. So not only is my advisory board, we meet quarterly and we're coming in to inform them, we're also training them. So when they interact in the community, that they will have the skills that they need. So it goes beyond just the church community. It's really the Black community as a whole. And I think that's one of the values, that we have. It's just not, they come to our meeting and it's a full house all the time, because it's not just us just giving them like, okay, this is the update and what should we do? It's actually, they're actually walking away with some type of training, something that can improve them. The other part is those church partnerships. I kind of went into what we do for recruiting and having them to assess their own congregation. So having them to do that self-assessment, providing the financial contribution, and customized support and education. To me, these things have been very, very important. And our outcomes that we look at, we have individual outcomes, community level, and organizational. And I think that's very important for us to for programs to understand where they want to be. And that will help guide the activities, the frequency, and let you know where to put all your attention on. Oh, I forgot this. And then also with our churches, we do pay attention to our geographic regions. We've worked with public health to find out what are those, almost like what's mentioned earlier, those hot spots, especially in the Southeast region, what areas we need to go to, those counties. And we specifically target, we welcome all churches, but we really target those counties that have high or more at risk with dementia. And, I would say here is that we welcome the church, all churches, but we want to make sure that those churches that are in those hotspots really, really understand how important it is, because many of times, especially in rural areas, the health system may not be as what it is in the urban area. And so the church is filling in the gap. And so, they're actually a system of care. And so we need to make sure that they understand that and we're able to support them. And then these are our just detailed more about the individual, the community level, and the organizational outcomes that we are working toward. So far, so the program we started in 2019, July 2019 to be exact. We signed our first partner January 2020, so right before the pandemic hit us hard. And I have to say, for these 18, 19 months, we have been able to sign 16 churches on. And I'm proud of our team and our work in this area, because this was during the pandemic. We thought everything was going to stop, just like everybody else. But they had needs, and we just had to pivot some of our things. But persons living with dementia, they didn't go away during the pandemic. These caregivers, they did not stop being a caregiver during the pandemic. And so we really were able to support these churches to be able for them to support their parishioners that were affected with dementia. So it's been great. And I just, sharing with you the different denominations that we have been working with. And all of our churches, they understand what an altar champion is. So once you become a partner, you're our champion. And so, we expect our churches to accept and value those people regardless of their cognitive abilities, make sure that they're supported and also spiritually and pastorally supported. And then that they realize that that person living with dementia can still participate in activities. So those are some of the things that we make sure that they fully understand when they become a partner with us. And here, this is just, they already know, the pastors already know too. When I come in, I talk about research and documentation and collecting data, because I want to make sure that we're able to share the work that we're doing, especially with Black churches and in the Black community. And so this is just some of our work that we've published out here. The altar logic model is actually in press right now. That would be published in the Nursing Administration Quarterly. So you can be on the lookout for that. And this is some information that you can contact us. Please, we're on Facebook, Twitter. If you're interested in learning more information, please give us a call. And I'm hoping I'm good with time, but as I wrap up, I would love to show you all a 90-second video to hear from our pastors of how this has really impacted them.
Most adult survivors of child abuse crave and dream relationships full of trust, love, and harmony. But mishap.
First memories that come to mind of attending church is being at church every day of the week with my grandmother. That's just how it was. I'm Dr. Fayron Epps, program lead for Alter, also an assistant professor at Emory University. Throughout my work doing research in the community, specifically with the African American community, I came to realize that a lot of people didn't know that this existed. They was unaware of what dementia was.
We learned so much about living with dementia and how it affects the person and the family.
Think of a program that is connecting the dots for people living with dementia, their caregivers, and their spirituality. The Alter program has really helped me to educate not only myself, but also the members of our church. It keeps me whole and it gives me a strength that sometimes I need.
We don't know who God is going to send to our churches, but we've got to be ready for everyone that he sends.
Thank you so much for the time. I will now turn it over to Dr. Rocha.
Welcome, everyone. Thank you so much for that incredible presentation. I am very honored and humbled to be in this space with you all today. Looking forward to sharing some what I feel is very important information. And I will go ahead and get us going at this point. So if you can give me one moment to get myself going. So what I'll be presenting on, I'm Judith Rocha. As you heard in my bio, I work for Northeastern University. I am faculty there. Also am the director of field education in the master's level social work program. I'm a licensed clinical social worker by profession and returned to school to obtain a PhD. And now I find myself in academia, something I definitely did not realize in my lifetime that I would be doing at this stage in life. But I am so grateful that I can be in these spaces. And so my presentation actually begins even before I started on this journey of seeking a doctoral degree. So I'll take you back a little bit to, what was it, 2005. Mom was diagnosed with with dementia at that point. And then February of 2006, we got then the full Alzheimer's disease diagnosis for Mom. So it's been 15 years now of learning with her, of realizing how our community in the Latinx community navigates these spaces of having a diagnosis such as Alzheimer's and dementia. We found that it was a bumpy road and continues to be. But in this process, though, we have definitely learned some incredible things and have realized that sometimes if you want to see something, you have to do it yourself. So that takes me to probably one of the first of these types of works that I am engaged in now that bring that same framework to mind, right? If we don't see it out there and we need it, we're going to try to find a way to get it going. So in just about 5 years ago in October, it was a fall October day, Mom and I participated in an activity, an art activity, and I'll show you an image in just a second, that brought us to realize that Mom enjoyed carrying out a stenciled art experience so much so that as we're driving home that night, she was just chatty Cathy. She said she felt honored to be able to produce an art painting that she would be able to put on her wall. And so with that in mind, something just sparked in my mind that said, we really need to think about this and how do we incorporate these spaces for our elders. It seemed like at this point, obviously she already had the diagnosis, but it seemed like it just sparked some light into her that I hadn't seen before, right? So I connected with a couple of colleagues. As I mentioned, Mom has a condition. My sister and I have been the caregivers for the past 15 years, and Mom currently lives with me for the past 5. And so at that point, 5 years ago, I figured I can't necessarily carry this out on my own. So I'm all about doing things in a collective. And so I connected with 2 other colleagues, which you'll see in this image, Yadira Montoya and Dr. Susan Aguinaga. The 3 of us brainstormed because I told them, I shared my experience and I said, hey, listen, I saw an opportunity to get some funding. It's $1,000. It's $1,000, but let's try and see if we can share this idea of ours of having art workshops for elders. And our thought at that point in time, because of my own personal experience, was to go ahead and simply say that it would be for folks that were living with some kind of dementia in their lives, particularly the Latinas and Latino elders, right? Because we saw that there was a huge need in the arts with regards to folks of older age. Typically, we see a lot of programming for youth. Maybe some sip and splash things are really getting trendy now for middle-aged folks, but we really felt that there was a huge need for some of our older folks in the community. And so we went ahead, we took that leap of faith, submitted our project in a 2-minute video. That was our proposal to the Chicago Community Trust Foundation. And we actually got awarded. There was 80+ entries from all over the Chicagoland area that were submitting their projects for their neighborhood. And at this point, I was living in Little Village, which is a Southwest side, low-income ethnic enclave of the city of Chicago. And they really wanted to focus in the South and West side. So if you folks know anything about Chicago, I know I definitely have heard that people outside of Chicago know this too. We're one of the most segregated cities in the States. And for that reason, many times we see that our resources are very limiting. We tend to stay within our particular neighborhood boundaries. And if something's not offered there, we may not take advantage of it, right? So we figured we really needed to be intentional when we proposed that we would carry out our particular workshops, because that was the point at that time, is to carry out in-person art workshops. This was obviously pre-pandemic, and that we would do it in predominantly Latinx communities. We started off with the neighborhoods of Little Village and Pilsen, which are again on the southwest side of the city. If you know Chicago, I know that Jason mentioned, there's a huge connection with tell me where you live and I'll tell you how healthy you probably are. That is very much applicable here in the city of Chicago. We know that the north side of the city is definitely populated by more affluent individuals, and they have several services, they have opportunities that aren't necessarily readily available for the south and west sides of Chicago. So when we posed our grant, we were very intentional to say Latinx communities in the south and west sides, right? And so we went ahead and we moved forward. You see here one of our very, very, very first participants, Augie, is pictured here at age 85. He is actually painting. If you could see, he's actually facing us, but you can see the image behind him is a fish. But that's not just any fish. It's actually a fish from a game called Loteria. The Loteria game, if you want to connect it to something that we would understand here in the United States, it's kind of like a picture bingo game, right? You have a card with 16 different images, 4 across, 4 down, and you're trying to make a connection between 4 of them, right, in any given direction, horizontally, vertically, or in an angle. And so one of the images of this game is exactly that fish, el pescado. So when we decided to carry out our workshops, we started off with 2, right? We had $1,000 to play with. And as we know, art supplies don't come cheap. So we figured that not only were we gonna buy art supplies, so I mentioned our 3 folks, right? Myself and 2 others. Not one of us has any background, professional background at least, in art making. So we had to hire community artists that would go ahead and conduct these art workshops, right? So our money was going to have to last us enough to pay a community artist, to pay for the art supplies. We know that we definitely need refreshments. So we decided to go ahead and order lunches for everyone. And then we, along with this concept of not only bringing self-expression opportunities to our folks, realize that there's a huge need in supporting folks' well-being with regards to mental and physical health. So the way that we decided to address these aspects was by going ahead and contracting an art therapist. So not only did we have a community artist available to facilitate these art workshops, but we actually also had the opportunity to bring in an art therapist that would help facilitate the experience for the individuals that were sitting down and carrying out these art experiences. So I'll say this: when we went ahead and produced a flyer and started circulating it, we started getting registrations from folks. We realized quickly that it was first targeted for folks that were living with Alzheimer's disease or some kind of dementia, and a caregiver, right, or a family member or someone that could come and facilitate a little closely more of that interaction if possible. Well, we started getting phone calls from folks that were dealing with or living with Parkinson's disease, because they thought that this would be a nice experience for them. Focusing on fine motor and concentration would be right up their alley as well. Then we got some more calls, and it was actually just general population elders. And so we said, well, we don't necessarily have to limit who this experience is for. Art making is very beneficial for everyone. Why not open it up? So we did. We were responsive at that point to the community's need, right? So they saw a flyer that said specifically Alzheimer's disease or some other dementia. Didn't matter. They went ahead and they called just to see if by chance they could be led into this workshop. And sure enough, of course, we were responsive to that and engaged in that. And now we've just become a general collective that focuses on providing art making experiences to folks that are 60 plus in the Latinx community, right? So the Latina and Latino elders are taking advantage of this opportunity. So why is this important? Why La Brocha? Why the model, which I'll go into in a little bit more detail in just a moment, but why would it be important? I mentioned we started off with this thought of Alzheimer's disease, right? Even if our folks that are coming through are not diagnosed or not experiencing and presenting with any memory loss or dementia related symptoms and situations, we know as a community, the three folks that came together, myself and the other two, we know about the work that we do and realize that by 2020, the stats that we see right now is that there's going to be an increase for our particular community by 832%. So think about that for a moment. 832% increase in terms of Alzheimer's disease by 2060, which is maybe a little bit over 30 years, but that's right around the corner when you think about all the things that we need to put into place to make sure that we are ready for something like that. And we also know that within our community, we, along with the Black community, have some higher rates in terms of more likely to develop this condition as compared to non-Latino whites. So we really have to be intentional about the kinds of things that we're producing and creating at this point, because it's going to impact a whole huge number of folks moving forward in the years to come. And then the final why, for us, it was very specific, right? So in this group of three co-founders, we're all Latinas, we're all from the Chicago and the Chicagoland area. We all come from having parents that were that are immigrants, and we were Chicago born or coming from our homeland at a young age, right? So we've seen that there's a huge gap many times in the way that we navigate different systems. And many times, yes, it is a linguistic limitation, but there's also some cultural appropriateness that comes with delivering services to individuals that many times doesn't get addressed, right? We always think, well, as long as we translate it to Spanish, we'll be great. Not the case, not the case at all. There really has to be a more closer connection to what that community and those individuals within that community are really needing. And for us, that was very important. So as we moved forward with our project, we continuously asked at the end of every workshop, how did you feel? What did you think? Anything we could do better, right? Because we were trying to be responsive to their needs and their time and their space. We were really hoping for their continued participation, and we definitely got it. We have a following now, and it's incredible to see, right? That the number of folks that travel around the city to try to come to one of our workshops. So where did this, I mentioned a bit about this, and I just wanted to show this image. This is us at that one workshop. This is Mom. And, representation matters, right? The reason why I took Mom to this particular art workshop at that point in time was because the theme of it was this actress, Maria Felix, the individual you see stenciled into that canvas. Maria Felix is a popular Mexican actress that Mom loves, an actress from had some great productions in the 40s and the 50s. And so because it was that connection, I said, oh, Mom might appreciate this, right? And sure enough, she did. So, we went ahead, like I said, and submitted for that award. We got our first $1,000 and we were on our way. And we've been growing ever since. It's been outstanding, just the level of wonderful praise that we get, not only from obviously funders, but from the community. The community is really seeking out these opportunities for us. And so here I give a little bit, a breakdown of what I mentioned before of our model. Community artists, right? We wanted to have some local folks. Representation matters. So we wanted to make sure that we got folks from not only the neighborhoods that we were providing these opportunities in, but that we were also bringing in the artists from that look and sound like us, right? That really can engage with our folks. So this was that opportunity. And then I mentioned the art therapist to make those further closer connections. We held these workshops in different community spaces. So senior centers, church basements, community centers. Folks were willing to let us use the space without questions asked, right? Many times they were just donated. We didn't have to pay a rental fee because they were really hungry for this type of work because they were hearing that things were needed, right? There's more of us in terms of our elder community out in the States at this point. And so there's a lot of need to keep them engaged. Healthy lunch, we actually went with a co-op, again, being very intentional about utilizing and being within that space. We would use co-ops and folks that would sell food that were local. We really wanted to put money back into the community. And then I mentioned mental health, physical health, the way that was addressed, we would have a literature available about Alzheimer's, about healthy eating, about the importance of physical activity and exercise. And so we had a resource table at every workshop where people could pick up brochures or books or any kind of information. Well, then the pandemic happened, right? And here we are. We had to quickly readjust what we were going to do. And so we decided, well, we can't do stuff in person. We might not even be able to do stuff remotely, right? We all have this advantage of having laptops and internet connections. Some of our folks don't. And some of our folks are just not technologically ready to learn a whole new system to engage in some more community time like this, right? So we said, well, we're gonna go back and take it to the basics. Let's start mailing things. Let's start delivering things. And we did. We hired a few artists from the neighborhood, again, right? Keeping it very intentional. Gathered local artists, paid them a stipend to create different images for us. And we created coloring books of our own artist images. Mailed these out with colored pencils and people just went ahead and ran with it. They loved it. We also created canvases and delivered those to folks. You have here one of our participants that did her painting at home. You see the candles and the flowers, very much a theme around, the Day of the Dead, and many times religiosity, right? Religion is very important, as we heard before, to many of our communities. So that was one activity that we did during this time. Next activity that we focused on, we started hearing from folks because not only were we doing that delivering of supplies and art activities, we were doing phone calls. We were doing wellness checks. It wasn't even in our scope of anticipated work to do with this project for us, but it was that time, right? The pandemic, our elders are some of the most vulnerable within this whole situation. And so we said, we can't just sit back and think we're going to send them art and they're going to be happy. We got to figure out how they're doing. So we had a group of volunteers touch base with our folks, and they really appreciated that. We even were able to make some referrals out to different things that they needed during that time that was so critical and continues to be, right? Well, in that moment, though, of those conversations, folks started saying how much they were cooking and how they had to maybe adjust some of their recipes because they weren't necessarily going to grocery shop as often. And so we decided, well, how about we do a recipe book? And with those recipes, we attach imagery that they can color, still sticking to not only the art of drawing and painting, but now even culinary art, right? So you see here an image of a couple of quotes and information of the different recipes that we have listed. Then we had the opportunity to connect with a photographer. And he said, let me come take pictures of your participants. we can do socially distanced images and photographs. And we did, and they loved it, right? So you see some of our folks here that were so excited about this opportunity. Some of these folks celebrated birthdays during this time and would get in contact with us and send us pictures of their 80th birthday, their 90th birthday. We even had one woman turned 100 during the pandemic. They did a drive-up caravan for her so that she could enjoy that moment because it was so special. And with that, I'd like to wrap that portion of my presentation and quickly run into the other one before I run out of time, because I think I've talked quite a bit. But here's some contact info. I am happy to share these slides so that it can go on to the rest of the folks that are participating in this presentation. So finally, I will speak quickly about caring of caregivers organically, COCO. So in my time with this work, I mentioned La Brocha was one of the first projects that I began with this thought of, if we don't see it, we do it, right? Well, caring of caregivers organically is yet another one. We have things like Savvy that has been translated to Spanish, but it hasn't been, remember I mentioned culturally appropriate, culturally responsive. Not that in Savvy, not that in other evidence-based interventions. This particular intervention is modeled after one that was created by Dr. Sandy Magaña for mothers, Latina mothers of children with developmental and intellectual disabilities. I went ahead and used that and adapted that to now fit Latinas that are caring for someone with Alzheimer's disease or related dementia. And it was piloted back in 2018, 2019, 8-week program at that point, in-person group held at a senior center in the Pilsen neighborhood, southwest side of the city, but pretty centrally located so folks from all over could come. We had that opportunity then. We got great feedback. Currently, we're actually working a team of 2 other folks and myself. Remember I said I need to do stuff in collectives. Dr. David Marquez from the University of Illinois in Chicago, and Yadira Montoya, once again, which is also my colleague from La Brocha. We're collaborating now to revise that in-person model and create this 10-week virtual model. These are conducted by 2 facilitators that we call acompañantes or companions. All the information that we did, everything that was adjusted and adapted for this intervention was done through stakeholders. Focus groups were conducted. We were able to hear from folks, not only people that were service providers, but caregivers themselves, right? We wanted to know, what do you need help with? What can we support you in to keep you healthy and well? Because if you are, then that's what you're taking to the next person, right? So I'm gonna leave it there. We have contact info for myself listed here. We're still in the process of the revisions and expect to be rolling out in 21-22. Thank you so much for your time.
All I can say is wow, wow, wow for everyone's presentation, from the personal anecdotes to the real life experience and how you all of the presenters have used this to influence the great work that was presented today. I'm not going to talk much because I know that there's a lot of questions that are in the chat. So Dr. Epps and Dr. Rocha and Jason, if you may come back on the screen so I can ask you a couple of questions. The first question is from Mackenzie. She asks, how do you recommend that organizations like Alzheimer's Association at the chapter level utilize some of these strategies to partner with Alter? I'm assuming this is for Dr. Epps.
So I think the first thing, they just have to contact us because one of the things for our local chapter in Georgia, we partner with them so they can provide some of the education that they already have in place, and they provide it to the churches. And when we go to other states, that's one of the first places we call is the chapter Alzheimer's Association, the local chapter, and also reach out to their other senior services to let them know that we're here and how we can partner together. Because once we get that partnership, we can bring other agencies in to provide education and additional support.
Perfect. Thank you for that response. I just want to note, because I see a lot of people have asked this question, all of the slides and information are going to be provided on our website, dementiacaregiving.org. And this will have all of the contact information and slides from all of the presenters today. And so that way, if you're interested in connecting with any of the presenters that I presented today, please feel free to contact them using the emails that are in their slides. I'm going to jump ahead and go to the next question. And this is also for Dr. Epps as well. Is it necessary for those offering programs in the African American community to be African American themselves?
Oh, that's such a good question. And so I'm gonna be honest, I'm torn, because initially I would say no, it does not. They don't have to be or identify with that race, ethnic, or culture. But it's important if they don't, they have to take the time to understand and learn from that culture. I just recently was in a group where that did not happen, and I had to come in and do damage control. So I want to let you know, then your colleagues, if you don't take that time to be passionate and understand a culture that you're not of, we have to come in and do damage control. And so I'm not saying that you have to be, but you have to be able to dedicate the time to understand it, be willing to come to church, sit in services. So when I bring colleagues with me that are not Black, I ask them to do these things. And if they cannot do that, then there's no way that they can really bring in the program or work with the church, because the church, they pay attention, and it's all about building trust with any of the communities we work with. And you just coming in there, the history of it, if always coming in and always just taking. And even as me, I am Black. And so I have to build that trust with them. I have to attend church events and engage. So I don't know if I answered it, but
I think that was a great response. I'm having flashbacks of, I'm from the South and I went to church several times, but I'm having flashbacks in your video, how you said you were at church like several times throughout the day. So it sounds like you really have to be a part of the community in order to do this work. So now I'm going to turn it over to Dr. Rocha. I think this question is for you. The question is there an attendance cap for the online program? I know that you talked about how you've taken a lot of the information and strategies and interventions that you developed to the online platform, but have you created an attendance cap? And can you talk a little bit more about that?
Sure. So we actually were thinking about that. We are thinking that our cap is going to be 10 folks and then 2 facilitators in the group. But then we're also going to have a tech person, right? So a third person with regards to supporting the 2 facilitators, so they don't have to worry about my mic's not on, my screen's not working, that type of thing. And the facilitators can just focus on providing the content. So we're thinking no more than 10. And we're going to our thought is to recruit 40 individuals for 4 different groups. So that way we have 10 folks in each.
Thank you for that response. And I see that you responded to some other questions that were catered towards you too. So thank you for that. I see another question that it's coming in, and I'll take this as kind of the last question. Are there any recommended models, frameworks, approaches to help guide adaptation work that are used frequently or you would recommend for anyone aiming to adapt existing materials? Though I do note the value of the stories behind your presentation is that you created your programs within and that for the communities versus focusing on adaptations of existing resources, materials, or programs. So that was really wordy. So I'm just going to repeat the first part of the question. Are there any recommended models, frameworks, approaches to help guide adaptation work that are frequently used?
I just throw out, there's a good resource that we found is the Georgetown University has a National Center for Cultural Competence, which really breaks down, they have a resource library that breaks this down by curriculum, by recommendations for the development of messaging and engagement and development of partnerships. So that's just one resource. I'm happy to put the link in the chat and for folks to utilize.
And I was going to mention, so I mentioned that my model was adapted from Dr. Sandy Magaña's work. Her work revolves around autism and intellectual and developmental disabilities. And she's done several interventions, and there has been variations of those. So that was the way that I went ahead and conducted the work that I did to adapting now to COCO, right? In terms of bringing the stakeholders together, having this public health model of community health workers be the ones offering the intervention, right? Like that's another piece of the work that she does. She's very, very intentional about making sure that that's the case. And so she would be another resource, Dr. Sandy Magaña or Sandra Magaña. She's actually out at University of Texas, Austin at this point, but she was at University of Illinois, Chicago, which is where I connected with her. So that would be another opportunity to see what a model was, and then the variations of that, because I know now that model, some of her models have been switched over to folks in the Chinese community, to folks internationally, right? So not only is it being used with Latinx communities here in the United States, but it's also being used in places like Colombia. And that looks a little different, right? There has to be adaptation to where you are. And so she created it here in the Midwest. Folks in California are also having to adapt it to their needs.
Thanks for noting that. I really like how you mentioned that you really have adapted to the communities that you have. In a lot of my work, we do a lot of cultural adaptations, but if you're working with one population, there are so many regional differences that make up, that are important to consider for culturally adapting programs and services. So at this time, I cannot say thank you enough to each and every one of the presenters. I could talk personally to you all for about 30 to 40 minutes, and I wish we were in person so we could have snacks and do that. I'm so grateful that we have recorded this presentation, and this information will be provided online at bolddementiacaregiving.org. All of the slides, all of the presentations will be online. Please, please, please reach out to us if you are a public health organization or agency that is needing support in uplifting or developing any type of supports to assist with dementia caregiving. In addition to having the online resources for cultural adaptations, we have a variety of other resources and materials that will be helpful. And also stay connected with us because we have another symposium coming up at the end of September. And this will focus on caregiving support for Native American and Asian Pacific Islander communities. So at this time, I can't say thank you enough, but if you really appreciate it and all the work that we did, please respond to the survey that you all will have once this session is closed. You all will be directed to a survey, and if you could take part just to give us some information about how we can improve our programs or what you would like to see as organizations on things that we can tackle or take on to really provide support and services. I hope that you all stay well and stay healthy and stay safe. Thank you for joining us today, and I hope that you continue to have a good week. Thank you so much.
Thank you.